Okay. Okay. I'd like to welcome Fiona today with us from the National Advocacy Service, and she's going to help talk about accessing the NDIS and the wonderful inroads they're making with supporting people living with a brain tumour. Over to you,
Thank
Fiona.
you, Ginta. Thank you very much for inviting us here today. National Advocacy Service is part of the Peace of Mind Foundation. Peace of Mind Foundation is a charitable organisation that's based in Geelong in Victoria, who came about in 2013 when a lady by the name of Carolyn Matthews passed away from a brain tumour, and the family, her husband and sister-in-law, decided a couple of years after her passing to create a charity that was there to support families direct. There's many charities out there that are supporting brain cancer research and finding a cure, but there are no organisations out there directly supporting the families and loved ones who are going through this diagnosis and survivorship journey. So in 2013, Peace of Mind Foundation was created. They predominantly work in the Barwon region, and the Barwon region is the health sector around Geelong, where Peace of Mind create financial packages. They provide small respite services. They do counselling, financial advice, and they run retreats, and the retreats are fantastic. So there is a women's retreat each year, a men's retreat, a bereaved retreat, and a family retreat. And those retreats are over a weekend, generally a 2-night stay, full day, Saturday, Sunday, where all activities are paid for, all families are welcome to attend, and with their carers if need be. They do have some nurses on staff, but predominantly it is about making sure that you have your own safety measures around you when you're on those retreats, but they're fully funded by the foundation. 2 years ago or so, they did a survey checking on how our brain tumour and brain cancer families were finding accessing NDIS assistance. And the results of that survey came back very clearly, identifying that 70% of families were being rejected by the NDIS on the first presentation of their application. It was generally noted that they were being rejected on the basis that the applications being submitted were medically based with information and not based on the impairments that that tumour and or tumours may have placed on the person that has been diagnosed. So it's important to remember with NDIS that it's about the disabilities that a tumour may have caused, and thinking about what disabilities are may not be what we see them as in real life. And we'll get into that when we talk about applications and the like. So in that process 2 years ago, I entered into that survey and said that I had found the application process quite easy, and I had found the NDIS services outstanding, and that I was quite mindful to me that for my partner who is diagnosed GBM, that it was actually increasing his survivorship by actually giving him the capacity to act and move in a more independent way and enable him to feel that his days mattered for what he wanted to include in them. So Peace of Mind Foundation asked of me would I consider doing some voluntary work. I said absolutely, of course, and I started to assist families in a voluntary capacity to access the NDIS, and did so quite successfully. In fact, 100% of my families in applying for NDIS were awarded packages and have been using them quite successfully. So last year, through some works with the CEO and staff of Peace of Mind Foundation and a gentleman by the name of Craig Cardinal, they put together packages and the like through to cure brain cancer. And they asked for a service to be funded to provide what we had been doing voluntarily to be done in a more formalised and paid role for multiple advocates across the country, and hence Cure Brain Cancer coming to the party meant that the National Advocacy Service was born. So we went live on the 1st of November of last year. We had already been receiving referrals for family leading up to our live date. We never have turned any single family away. The vision of Peace of Mind Foundation is that no Australian will go unsupported, and that their services will be provided here and now. So we do not have waiting lists. We do not have charges. We treat each individual family on their own needs and their own requirements. And our services come for as long as they're needed at no charge. And any of our time and facilities that we utilise are funded for us either by Cure Brain Cancer or by Peace of Mind Foundation. So we're very lucky with that. So why? If I'm looking after somebody with a terminal brain tumour, why am I putting my time out there to assist other people? I suppose when I think about it is that the first 14 months of my partner's diagnosis, I felt very unsupported. I felt very unsupported. We had a wonderful medical team that were looking after us very, very well, but when we would leave the hospital doors, our worlds would turn grey and we would not know who to turn to. We didn't know who to go and ask questions of. We didn't know what kind of supports were out there for us, and nobody was certainly helping us to head in any direction whatsoever. So I would go down the rabbit hole of research and the like, because that's who I am, but it's not necessarily who everybody else is. So I found that process okay for me, and daunting at times, that I felt that I could bring that skill set in to assist other families. And so it's not because our families don't have the capacity to do what we are doing for them. It's that some of us need just some guidance. They need somebody to give that little bit of advice and helping hand to say, this is where you can go, this is what it can offer you, and this is how we access it. So the National Advocacy Service help people to access Centrelink, look for local community resources. We assist with NDIS applications. We assist with My Aged Care. We assist families to look at engaging with their local palliative care team as soon as possible. We liaise backwards and forwards with your health team, with your therapy teams, with your occupational speech, physio, whoever, to make sure that the level of services that you are receiving are appropriate for the symptoms that the person diagnosed has, but equally that the entire support network around that person who is diagnosed is equally supported. Because in a carer role with brain tumours specifically, the carer burnout rate is very, very high. A lot of the time that your focus as a carer may well be on that person who's diagnosed, you put yourself last because you feel that that's the right thing to do. But ultimately what that does is puts you both in a very compromised situation. So we're very mindful of that, and we're very supportive of that. The feedback that we get back from our clients more so is, though, it's not just about that we're guiding people through a process to get a support in place. It is the fact that we align one person per family when the referral comes through. So if I receive that referral for a family on any given day, for as long as that family needs me, I remain that single point of contact for that family, meaning we share things, we talk about life, we talk about the upsides, we talk about the downsides, we actually form a connection. Now, it's not counselling, it's not a counselling service, but it is a service that when I start to see something going a little awry, per se, that I feel the right to turn around in that space and say, this isn't sounding quite right. This isn't sounding like where we were only a few weeks ago. How about we involve the medical team? Or how about we involve your OT team? How about if we get some more supports in place? So with all of the services that we provide, we spend quite an amount of considerable time with NDIS applications. And we're big believers that the NDIS application should start to take place as little as 6 weeks post-diagnosis. There is a misconception out there, well, misconception is probably the wrong word, but there seems to be a general consensus that we wait to do an NDIS application for when the patient is bad enough, right? And that that level of bad enough is the perception of the person who's deciding that. And really, the person who needs to decide that is the person who has been diagnosed or their closest loved one or carer, because we will see the deficits in them before likely their medical team will. We'll see where they're slipping. We'll see where they're not able to function as they normally did previously. So when we do an NDIS application, we focus on those deficits that are happening. Now, that may be the inability to drive or work. It could be intense fatigue. It could be short-term memory deficits. It could be the inability to do executive processing anymore. It could be the lack of being able to be responsible for scheduling of events. Like, these are all cognitive deficits, but aren't necessarily physical deficits. So they, regardless, are classified with NDIS as an impairment. And impairments, therefore, create an approval within the NDIS system to receive supports. So what do the NDIS provide? What sort of supports do they provide? So they will cover your support workers. They will cover people to come in and help to clean the house, do the yard work, do some minor home maintenance of bits and pieces. They will pay for allied health therapies where evidence has been shown that they are required for that participant to need. They will cover, in some instances, specialty disability accommodation. They will cover 24-hour support needs for those that have high-end needs. It isn't a one fit for all. Every single NDIS plan is put together on the merits of each individual. So we work closely with the family to make sure that during the application and planning phase of an NDIS application, that we have managed to capture what are the concerns and therefore advocate for what the supports are to assist. So when we look at, say, as an example, my partner, Jeff, when we first applied for NDIS, I didn't really use support workers very much in the beginning. He was, looking after himself for most part. He was able to get around the house. I wasn't working, so I drove him to appointments and the like. But I started to recognise that he was falling into my life and doing what my life entailed, rather than necessarily following what his own wishes were and what his own independence showed him that he wanted to do. So I brought in support workers 3 days a week, and all of a sudden Jeff's out surfing, he's out going to the beach, he's going bushwalking, he's going to Bunnings to pick up bits and pieces and do jobs around the house, and he's starting to feel that sense of things being worthwhile for him and that he's accomplishing and achieving. Now that we get a couple of years further down the track, we are now sadly in his palliative stage of his diagnosis. Our NDIS package has grown in time with his needs escalating and growing as well. So now we have all hired equipment, we have some purchased equipment, I have carers in the house 24 hours a day. They make his lunch, they help with his breakfast, they help with his showering, and they work with me and very respectfully of what I need them to do as well. So the actual level of supports that you can receive through NDIS can either be minor, if your needs are considered to be minor in your eyes, or they can escalate in time as the needs are escalating with the condition. So I suppose what I'm saying is there's no rules, there's no set recipe that every single person must follow with NDIS. It's all very personalised. Some other examples, a young fellow, 31 years old in northern New South Wales, diagnosed brain tumour back in 2020, given 6 months to live. He is still surviving now and surviving quite well, living at home with his parents. Recently, he had a spate of seizures. He'd already had an NDIS plan, but these seizures hospitalised him. And the hospital said his needs are so complex now following these seizures that he really can't come home. The home environment is not supportive to his needs. Therefore, he must go to aged care to be looked after. The family got back in touch with me when we had done some original work. They knew to come back to me. They said, what do we do about this? And I said, we escalate his needs through the NDIS, and the NDIS will work with the hospital, and we will get the needs set up at home for him to be able to return to home. He is still in hospital at the moment, but 2 NDIS plans have occurred where the entire plan is being reviewed, And the aim is to get that boy home with his parents with 24/7 supports and all of the equipment that they will need for him to be at home. And that's because he is 30 years old and should not be being placed into aged care. It's not appropriate for a 30-year-old. So thankfully, the NDIS can see that his desire is to be at home, and that's what they will facilitate. I have another gentleman, he's 72. Did you need to ask something, Jinta?
Yeah, can you just go back one stage? So as we know, people in our group, there's many different types of brain tumours and at very different levels. So what's the criteria for applying for NDIS? I think from what I understand, it has to be a primary tumour.
No, it doesn't. They need to be under 65 years of age, an Australian resident, and they need to show impairments across one or more of the functional domains. To be able to access the National Advocacy Service to assist people to apply for NDIS, for us to provide one-on-one assistance for people, they need to have a primary brain tumour. Yeah. So for us to help those families, primary brain tumour for us, but the diagnosis of the tumour is no bearing to NDIS. We need to demonstrate to the NDIS that that tumour has created impairments across one or more of the functional domains.
Okay, great. And one more question. I was also led to believe that they have to have had surgery to access this because it can't then falls under traumatic brain injury. Is that also a fallacy?
Not true. So the criteria for NDIS approval is that you can demonstrate that there is no treatment or surgical intervention available that will cure or alleviate or remove the condition from that person and that individual. So when we do our applications into the NDIS, we apply under the banner of acquired brain injury subsequent to the diagnosis of insert brain tumour name here. Yes, we will make it clear that they've had surgery completed if they have, but we concentrate more on the treatments of, and we state emphatically that our treatments are known to be symptomatic management only and not of a curative nature. So therefore, that provides the acceptance criteria into the NDIS. And these are the parts that were missing in previous applications of those 70% of people who were rejected, really not understanding or even being guided as to how specific that information needed to be for the NDIS. So we're making it clear that we're not applying for NDIS on the basis because a client has a brain tumour. We're applying on the basis of what the impairments are that tumour positioning has caused to that person's processing and or mobility concerns. So we have another gentleman, so it's not all about NDIS. We have a 72-year-old gentleman with his wife of similar age. She is GBM, located in regional Victoria. He was very overwhelmed with the process. She was very poorly. No one had really advised them what services were out there. And he and I went through the My Aged Care process together, which is far more difficult than NDIS, sadly. I would like to, think that caring for our senior Australians would be quite comprehensive and quite easy to navigate through. It is incredibly tough. And the financial resourcing available for our senior Australians is very minimal and does not stretch very far at all. However, we managed to pull together one of the hospital programs for assistance in the home whilst we waited for My Aged Care, and made sure that family was supported in that way. Ultimately, her My Aged Care package did come through at what's called a level 4, which is the highest level of My Aged Care packaging that can come through. And that also includes allied health therapies, respite, people to come into the home to help prepare meals, meal provisions, housekeeping, and the like. So as a family, that gentleman had felt very isolated and very alone in that process of trying to get the right assistance for his wife. and with us stepping in and just slowly guiding him along the way. Every single phone call would be followed up with an email reminding him of what we had discussed during that call, because sometimes it's just not easy to remember all that type of new information. So he was able to go back over those notes quite regularly and do his little bits of homework and then come back to me. Ultimately, within 4 months, we had that family very well supported, and that he was far more comfortable in himself and actually going back to doing things in his own life that made and were of importance to him. And then we come down to our people who are admitted into hospital. There's been 2 clients. One is one of your local clients there, Jinta, who sadly passed away very recently. We got an NDIS package together for this beautiful woman and her husband and her children for at home to get her home. But unfortunately, her tumour had other ideas, and after that plan was approved, they made the hard decision to retain her in hospital, that would be where she would be best supported at that time. We've also provided support to another gentleman. He is 64 years of age and turns 65 on the 4th of July. We pushed to that family at the time where they felt that they were doing okay with things, that if they waited until things were not okay, that gentleman would be pushed down the road of my aged care and therefore not adequately supported. NDIS, in the case of this gentleman, they knew that he was in final stages for his disease. However, they put together a $450, I think it was, $1,000 package. And that gentleman came home after 144 days, admitted in the palliative care unit, came home, and he will pass away at home with his wife, which is where he chose to be. So we support all ages. We support all diagnoses. We support cancerous or benign. As long as your tumour is a primary tumour to you, the National Advocacy Service will step in and assist you. We might assist you just one time. We might assist you for months. We could assist you for years. There is no time limit on how long we provide our supports for, but we guarantee to you that you will have the one advocate all the way through, unless, of course, one of us is sick or away on holidays and something pressing is happening. My clients are very important to me. The stars and hearts that you can see behind me represent every family that I'm working with now or have worked with, and the hearts are of those who have sadly passed away. I call it my acknowledgement wall, because every single day, every one of them make me feel stronger inside of myself, remind me that I'm not alone in the brain cancer journey that I'm on with my partner, but also reminds me of families that will not go through what I went through in the first 14 months of Jeff's diagnosis. They are families who will be supported and who will know what direction they can go in to obtain help. So I hope today's session has been of help to people. I invite you to go to the Peace of Mind Foundation's website and click on the request support button and tick the box for the National Advocacy Service if you would like our team to get in touch, even if it's just for a chat, to just see what's out there and available and how that might assist you. We're more than happy to help where we can. And thanks, Jinta, for inviting us today. We're very, very grateful for the invitation.
Thank you, Fiona. Thank you so much for your time and your insight and the amazing work you and your team are doing. I really hope that when we post this information session on the Adelaide Brain Tumour Support Group, that you give people the confidence to push that button and seek help.
Yeah, I hope so. Yeah, hope so. That would be great. Absolutely great.
Thanks a lot.